Hi, I'm Suzanne Whatley, and I'm here at Glendale Fire Headquarters near the Galleria talking with Judy Van Houten. Judy is the director of the Glendale Adventist Medical Center, Occupational Medicine Center, and Mobile Unit Services. Judy,
good morning.
Tell us about this Winnebago here and its special equipment and what it does.
Well, this is a customized Winnebago motorhome that has been tailored to our specifications to conduct physical exams and x-rays out in the workplace. So today we're going to be conducting annual exams for the firefighters at Glendale Fire.
So wherever the employees of your clients are, you can bring this unit to them?
Absolutely.
And what does it do?
We have a doctor, we have technicians, we can do medical testing and conduct medical examinations and ensure that people are safe and healthy to do their day-to-day jobs.
So there's no waiting at the doctor's office. People are in and out and back at their desks or back in their fire rigs in short order.
Absolutely. Our program's been with us for almost 20 years. Conducting these kinds of services. Our crew has such an extensive clientele that they book their calendar out a year in advance.
Well, let's meet some of this crew. Aurelia Navarez is a medical assistant here with the mobile unit. Aurelia, how many people do you see in a day sometimes?
Oh, it varies. We see maybe from like 20 to 40 people.
And you've got to keep them moving through the door and out again.
Yes, definitely.
Now, they start by signing in here, and you have them fill out some forms?
Yes, we have them sign in. We have them fill out their questionnaires, and then I check their height and weight, blood pressures, and then I send them up to the next step.
This is Paul May. Paul is an x-ray technician with the mobile unit, and his is the first smiling face that people see when they walk in the door. Paul, what do you do with the folks when they come in?
Well, the first thing they usually do is come over to this station here, which is spirometry. And at this station, we measure lung function, how well they blast the air out. We also measure pulse ox here, which is oxygen saturation in the blood. That kind of tells us what's going on if the gas exchanges are all happening correctly. And from here, we would actually come to this station. On this side, basically, we do vision screening, any lab work, blood work, urinalysis, all takes place here.
So after the x-ray, are they done?
No, actually, after they're done with us, they head right on over to the front. And that's where they have the physical exam with the doctor.
Thanks, Paul. Dr. Brian Kutzenai is the occupational medicine physician who is the medical director of the mobile unit. And once people see Paul, they come to see him. What do you do with the folks when they come to see you?
Well, after they've had their initial testing, I bring them up front here to the exam area. And we do different types of evaluations here, examinations and history taking, depending on what the type of evaluation is we're doing for the particular work and exposures that this person is involved with.
This is John Ober. John is the manager of the Mobile Unit Services. And John, I understand you've been doing this for a long time.
Yes, ma'am. 17 years, since 1994.
What do you like about your job?
It's get to go out in the field and be a different place every day. Is kind of nice. You're not cooped in an office or anything, so I like being out and about.
What sort of places do you find yourself?
We go to fire departments, municipalities, school districts, places like that. We do mining companies, just anywhere that workers would have an OSHA mandated physical requirements for respirator use and things like that.
So you see some of the same people every year?
Yes, ma'am. Year after year.
John, thank you.
You're welcome.
So as you can see, beneath this mild-mannered Winnebago exterior is a one-stop shop promoting employee health. Bye for now from the Glendale Fire Headquarters.
Good evening, welcome back to HEALTHline. Tonight it's the conversation of occupational medicine. Joining us is the director from Glendale Adventist Medical Center of Occupational Medicine, Judy Van Houten, and the medical director, new on campus, Dr. Matthew Chan. Welcome.
Thank you.
Your mission is, I want to help people to work healthy so that they can live well.
Absolutely.
How do you bring that into what you do then?
Well, part of that mission comes from the fact that I believe that workers, or that the working population is a captive audience to a lot of population-based medicine interventions. And that's primarily because, we spend a lot of time at work. We all do. We spend the vast majority of our waking hours at work.
8 to 10 to 12 to 14 hours a day. So then, and the people that you work with end up becoming your friends.
Exactly. And on top of that, many people place their identity in their careers. I'm a plumber, I'm a teacher, I'm the director of the Occupational Medicine Center. They place a great deal of their identity in what they do, you know. And so I think stating all that, we can understand that the workplace is a prime arena for healthy choices to be made, and a prime area for an environment, a healthy environment to be fostered such that those choices are more easily made.
And you partner with employers to help keep their workers healthy, and how does that help keep their costs down, Judy?
Well, if we're able to assist them with health promotion activities, then that directly goes back to their health insurance premiums.
Such as?
Well, for example, if we go out and do a health fair and we screen 50 people for diabetes and we identify 1 or 2 people that need to follow up with their primary care physician for additional testing and management, we potentially can really impact the bottom line of their health insurance premiums, because though that's preventive care that's being provided as opposed to treating the full-blown disease process.
And not only that, I think also with a healthier population, they're more productive, there's less lost time, and people are happier at work. And so when they're happier and healthier at work, they can live well, they can live more abundant lives.
Okay, but what about the unhappy employee, and what about the person that, because we've talked about
see them
this.
all the time in our clinic.
You know who you are. Do not say you don't know who you are. What about the person then that works, that will smack their elbow on the copy machine,
Sure.
and that they're going to create a claim or do
So
what have
funny.
not? So
I just had a patient that had that exact claim.
okay, you
last
said you
week.
would not call me out. That is so embarrassing.
It's feeling better, though.
It is. It's the other elbow. Oh. So what happens with that?
So I'll tell you exactly what happened with this particular
Please.
patient, if that's okay.
It is.
She did indeed hit her elbow against the copy machine to the extent that the copy machine almost fell on her foot, but it didn't, fortunately. She came to my clinic, I examined her, and she was fine. There was no fracture, there was no dislocation, there was hardly any bruising or swelling, but she felt some pain. We treated it with some medications.
Okay, now, I seriously, no, I seriously love a good cliffhanger, and you know what, you were going to too. Okay, so if you hit your elbow on that copy machine and you're watching, we're going to tell the truth about your story. Do not go away.
Hello there. I'm Dr. Matthew Chan, the new medical director of the Occupational Medicine Center at Glendale Adventist Medical Center, and I'm here today to give you a health tip. The current recommendation is that we get anywhere between 20 and 30 minutes of exercise per day, about 3 days per week. That has been found to demonstrate benefits in the areas of cardiovascular disease, musculoskeletal health, and overall happiness and job satisfaction. And the good news is you don't have to do 30 consecutive minutes. You can actually break it up. So for example, I can go to work and exercise for 10 minutes quickly here on my break, and then do another 10 minutes later on in the afternoon, and when I get home, I can go for a quick 10-minute brisk walk. There, I've just accumulated 30 minutes in one day, and I didn't really have to go to the gym or set aside a significant amount of time to do so. And I can do that as many days of the week as possible. Just that amount of exercise alone will improve your health by leaps and bounds. And you'll notice an effect not only at home, but at work, and you'll be able to work healthy so that you can live the most abundant life possible.
Okay, I know you were so excited for this cliffhanger. Okay, Dr. Chan, so
Yes.
please continue.
Okay, so this patient of mine that was a very nice lady, who shall remain nameless, and the place of her employment shall remain nameless as well, wanted to be off work for this little bone contusion that she experienced. And obviously, when I put someone off work, there has to be medical reasons for it. I have to justify it with medical necessity. And this case clearly didn't require someone to be off work, and she was, proposing that I put her off work for about a couple of weeks. And so there was obviously something else going on, and having to dig deeper is really what you have to do in order to figure out why is she here. So the question I proposed to her was, so why do you feel you need to be off work? And she brought up a myriad of other complaints, and I found out there were some stressors going on at home, stressors going on at work, et cetera, et cetera.
Can you then give her time off?
No,
okay.
Unfortunately not. Unfortunately not. And so that's when we have to come in and explain to the patient that, this is probably best dealt with your primary doctor. There's other things going on that probably you can follow up with him on. But here, I'm just letting you know that I'm here for you with respect to your elbow. You're going to be fine. and I'll let your employer know what's going on with that. But ultimately, we have to do what's best for the patient and best for all parties involved. That includes the patient, the insurer, and the employer.
Interesting.
Now, copier injuries, I have to imagine, aren't terribly frequent, but what are some of the more common ways that people injure themselves at work? And are there some takeaways for our viewers that how they can avoid injury and hazards in the workplace?
Yeah, what do you see all the time, Judy?
Well, back injuries remain the most common sort of workplace injury, followed by sprains and strains, cumulative trauma, and occasionally, someone will have a cut or a laceration or a traffic accident, things of that nature. I think that the keys to preventing those injuries is, certainly having a heads up about your workplace and being mindful of the environment that you're in. Another facet of it is just the whole healthy lifestyle and healthy choices. Regular exercise, doing little stretching and warm-up activities before you begin your work day.
Do you find a lot of people get hurt that sit at a desk that are stagnant and they immediately get out of their chair and they hurt themselves?
Absolutely.
And all these stories are like,
Absolutely.
Because we just did a great piece and we talked about people that are stuck at their desks to allow themselves time every day
Absolutely.
to get up, to stretch, to eat healthy, to move, and to not have the excuse of, well, I'm stuck behind a desk. Get away from your desk, take 10 minutes and live your life. Is that part of the health fairs that you talk about?
Absolutely.
Yeah.
So then you encourage.
All of those things are very important.
So occupational medicine encourages
Yes.
a healthy lifestyle and encourages the conversation of making healthier choices with
Absolutely.
employers.
And you
Yes.
talked about exercising. We can incorporate exercise into the daily routine of the workplace. People think that they don't have time to exercise because they're at work all the time. They don't have time to go to the gym. They can't walk their dog as much because they're spending 12 hours a day.
And you look at them and say, you've been yammering for 10 minutes. You could have gone for
Right,
a walk around.
and so
It's an excuse.
You mentioned a time frame of 150 hours a week of exercising. That seems a bit extreme, but it's not. Perhaps not for you. But there is a guideline. We have the physical activity guidelines for Americans that just came out a few years ago as to how much exercise to accumulate within a day and within a week. And the recommendation currently is that adults get about 30 minutes of exercise, aerobic exercise, every day for 3 days a week. The good news is that those 30 minutes do not have to be consecutive. You can do bouts of 10 minutes here, and there throughout your work hour, throughout your work day. Mm-hmm. And so you can incorporate exercise into your routine if you get up and stretch, walk around, and so forth.
So how often do you recommend people get up from the computer, for example? So many of us spend our days at keyboards and screens. How frequently do we need to get up, and what should we do in order to limber our body up and get the stress of that being on the computer out
Absolutely.
of our systems?
Well, the first step is to have proper ergonomics, and so to have your chair adjusted, your desk to sit properly at your chair. Those things are paramount because many cumulative trauma injuries result from poor ergonomics, and oftentimes the treatment is very simple. We have an ergonomic evaluation, things are adjusted, and the patient does better. But to answer the question as to how frequently should you get up, I would say about every hour, just take 5 minutes to take a brisk walk around your office, to stretch all your major muscle groups, which includes your lower legs, your back, and your upper extremities.
And you can also, crinkle your toes and do back and forth. And we were giving you such easy in-office exercises, more with occupational medicine when we come back. And we'll also address real quickly the dirty drug test, what you need to know. Don't go away.